Hi there, my name is Sarah and I am going to have a coronectomy in less than 48 hours. And I wanted to film this video because there's so little information about a coronectomy, both pre, during, and post-op. And I want to share my story. I'm going to film this video now, which is pre. I'm hopefully going to do some kind of during or post, most likely post, and then in a couple months I'll do another follow-up because this is a process. So first of all, here's my history. I have 2 lower wisdom teeth that were never removed when I was in high school, and it's too bad. Just at the time, I think my family had a lot going on, people forgot, and by the time I realized that I needed to get them taken out, I didn't have any money. I was in graduate school and I felt like they were really pushy, and I didn't understand why they were pushing me to get them extracted. It was gonna cost like $1,000 and I was like, no thank you. So now I'm in my early 40s and they're like, okay, you need to think about your wisdom teeth. And what has happened is that they're impacted. They partially erupted, both sides. One is barely out, one is maybe 25% out. It has come in on an angle, not like horizontal and certainly not vertical, but probably you know, diagonal. I don't know what it is, how you describe it, but it's stuck. It is not moving and it's just sitting there not being functional because it can't contact its little partner upstairs. And after just kind of, you know, trying to take care of it and brushing it, my dentist said, you need to look into getting it removed. And I talked to 2 different oral surgeons. The first one I really liked, and he said he did not want to do a wisdom tooth extraction on me because of the concern about how close the roots are to my nerve. And I mean, it's really bad. I've done all the tests, like I've done a CT and I've done an x-ray, and they're right there. So he said that would not be something he'd want to do. He'd recommend a coronectomy, but he really didn't want to do either on me. So I went to the second one, and this was already has been a process. This was over months. The second oral surgeon said, I'll do a wisdom tooth extraction on you, but I think you've got a 25% chance of having permanent numbness in your jaw for life. And I'm a speech pathologist. I can't have permanent numbness. It's just could impact my livelihood, and that's just not something I'm willing to do. So I went back to my dentist having had both of these consultations, and my dentist said, well, I really do think you need to have a coronectomy. So I went back to the first guy, and he said he would do a coronectomy, and he explained the whole procedure. What it means is that instead of extracting the tooth, they take the crown and then they seal it up. He says that he will need to stitch, and then, you know, hopefully that will solve the problem. Now, he said the literature said that 20% of people who have this happen get an infection and have complications. However, in his practice, he's seen pretty higher rates of complications, to the point that he even said 50% of people have complications. Now, I don't like that number, but I also know that if 50% don't have complications, I have a much lower risk of having nerve damage. So I'd rather take my chances than go through the wisdom tooth extraction process, which has a much higher risk of everything. I made the decision to do the coronectomy. I also made the decision, even though they suggested doing it on both, I said I just want to do it on one. I want to see how it goes. There's not necessarily a rush. This one has gotten food stuck in it. And so I've needed to, you know, go and help it out at the dentist, and that's part of why I've gone to the dentist twice for having food stuck in it last year, and that's why she wants me to take action. The oral surgeon on Friday will be removing the crown of my tooth. They will numb me. They will also
give me nitrous gas.
And I will not be put under, which is really nice. I'm happy I'm not gonna be put under, but they said I definitely need somebody to drive me, so my husband will be doing that. I will be put on antibiotics, and then he'll stitch me up. And I'm hoping that I will not get an infection and that everything will be okay. Now, I've researched quite a bit on Google about this. They have actually said on many studies an infection rate of 10%. So I don't know what's going to happen. I'm hoping it's a low chance of infection. They have also said that one thing that they for sure almost always see is that the roots do move. Now, I'm okay if they move in that they've gotten stuck. They can't get any higher. So if they move, or if this tooth, once it gets its crown taken off, decides it wants to try to erupt, it will need to be extracted. But the great news, and this is what my dentist told me, she said if it moves and it has to be extracted, it will hopefully be off the nerve. And the oral surgeon said sometimes what happens is when the tooth is right on the nerve, it comes up and just like kind of like a trampoline, the nerve follows it. I don't know. I've never done this before, but hopefully this will all turn out great. Yeah, so I'm gonna get just one done. That is because I'm gonna try then to eat more on my right side during recovery, because I thought if I got them both done and there's such a high risk of infection, why would it would be very hard for me to potentially keep both sides clean if I'm in pain and bleeding. So you know what? I'm just gonna do one at a time. Another thing the dentist said to me that kind of freaked me out was, he said, you have a small airway. So that's part of why he didn't want to put me under. Great, I have a small airway, just what I wanted to hear. But anyway, thankfully I'm not getting put out for this. So that's the wrap up. I wanted to give you a pre-op. This is a discussion about my case. I'm gonna do a post-op as long as I'm not in too much pain and I'm able to record it. I'd like to do it in 2 days when I've had my procedure. And then, like I said, they like to have you come back, and I don't know if it's 3 or 6 months, they have you come back and do a check. And they'll do an x-ray and see how it is. You know, fingers crossed this is the right choice. And like I said, I just wanted to get this out there because I could find virtually no information about the coronectomy, and I wanted to give you some more information and some like video knowledge and experience of a patient first person. Anyway, hang in there, watch the next video. You can subscribe if you want. I'd love it if you like this video because then it could get higher up in searches for coronectomies. So thank you, and I'll see you in the next video.